This is Jennifer Sale, and I'm Dr. Peter Van Houten, and today we're going to be talking to you about one of the key components of having an integrated behavioral health program in the primary care setting. What we'll be talking about is the warm handoff. Remember, integrated behavioral health is where you have, in a primary medical care setting, behavioralists or lifestyle management personnel who are therapists, usually a psychologist or an LCSW, that work right along with the medical practitioners. And throughout the day, they consult with one another and actually do this procedure we call the warm handoff, where we actually make an immediate referral in real time from a medical provider to the behavioralist so that the patient actually has their initial visit right at the end of their medical visit. This process of the warm handoff, which we'll actually have a chance to show you about 10 different scenarios of, so you'll have a real good appreciation for exactly what we're describing, is actually a key component of a good integrated behavioral health program. We've actually found that even though we have a behavioralist, a therapist right on site, and it's easy for us to make referrals to the behavioralist, if we don't do this warm handoff approach where there's actually this introduction to the behavioralist, that actually cuts the number of patients that make it for a full visit to the behavioralist by about 50%. Basically, what we found was that if we just made a referral and didn't do this warm handoff introduction, only about 40% of the patients ended up actually making a visit and completing it with the behavioralist. If we did the warm handoff, it was over 80%. So it, again, more than doubled the number of people who ended up getting a complete first visit with a behavioralist to initiate some sort of therapy. One additional benefit of doing the warm handoff is it turns out that for many insurances, including Medicare in many states, Medicaid or Medi-Cal in California, the CMSP program in California, that they allow same-day appointments. And so it's possible for the medical provider and the behavioralist to see the patient in the same day. And so including a little warm handoff as a transition between the two visits often ensures the patient begins their therapy with their first visit with the behavioralist the same day.
There are several benefits for the patient with the warm handoff. I think one is that the patient really feels that they're part of a team. They can see that the medical provider and the behavioralist are a team, and they feel part of that. And I think it enhances their positive expectations of what's going to be happening. I think the warm handoff really reassures patients that there's going to be good communication between their medical provider and the behavioralist. And I think another benefit for patients is that there's no time gap in the referral process. So, the medical provider hands over the case and the patient to the behavioralist immediately, and treatment gets started much sooner than it would perhaps out in the community or in some other type of agency.
Now, what you'll find on this DVD is about 10 different scenarios that we've crafted so you'll get a real experience of what it's like to perform a warm handoff in the medical setting. We've tried to use common everyday examples so that medical providers and behavioralists can get a real feel for the language that we use and how we procedurally do a warm handoff, and also the kind of questionnaires that we will often have the patient do while we're out of the room, which gives us additional information and makes a very efficient use of time. The patients that you're going to be seeing today, in fact, are all staff members here at our clinic who've very gamely volunteered to be model patients for us. But I actually think you'll see that they've done a good job to reflect the way an actual patient would behave under these sorts of circumstances. The questionnaires that we'll be using today are commonly available. They include the Mini, which is a general screen, including a screen for depression and anxiety, the PHQ-9 questionnaire for depression, the MDQ or mood disorder questionnaire for bipolar disorder, the Epworth daytime sleepiness screen, and also the DAST, drug abuse screen. The basic components of the warm handoff are simple. First, the medical provider is going to explain to the patient that he'll go and get the behavioralist and be returning with them. Usually we take advantage of that 4 or 5 minutes that we're out of the room to let the patient fill out helpful questionnaires for us, often a mini or some other kind of questionnaire that'll give us additional information. When we return, the first step is to introduce the patient to the behavioralist. And I'll have to tell you, this is always the magic moment. Often you'll feel from patients they're not real sure they want to do this program, but when they actually meet the behavioralist and see you discussing their case right in front of them, just including them right in the whole discussion, there's this magical thing that happens where suddenly they realize that this is a good thing to do, and you can see their buy-in. At that point, the medical provider departs and the behavioralist begins discussion, actually initiates therapy with the patient.